When you use erbium laser, remember it looks like water. What you do there is dehydration. You shine a little bit of light, laser light, around the tissue, it dehydrates and shrinks, and kind of falls to the side. You get a very nice margin. About 1 day later, all these come back. Okay. So compare that to electrosurgery. That's what people know in mass. Electrosurgery works, you get the same effect, but what happens? 3 months later, recession. Because you burn the tissue. It looks okay for now. 3 months later, when all the charring has fallen off and everything back to healthy state, you actually have recession. With laser, you don't get that. Here's a fibroma. Inside of the lip mouth, right around the lip, cut it off right after the surgery. The surface, of course they dried it, but you can see it looks almost normal. You don't have to do anything to this wound. No medicine, no stitching, nothing. Don't leave it alone. 6 days later, it is. Can you reach this in 6 days with a knife? No way. No way. There's no way you get this. Why? Because with knife, there's a lot of bleeding. So the healing process is 2 weeks. If you do stitch, you have to take out a stitch and wait for it to heal. And when you do stitch, you're taking 2 parts of tissue together that wasn't supposed to be together to start with. So there's a process where they have to melt together, basically, grow into each other. You don't get this kind of surface in 6 days. There's a frenum phenectomy. Okay. How you cut a frenum is the same as how you normally cut with a knife or scissors. But just you're using a different tool. Instead of a knife, you use the laser. And during the process, you have a little bit of bleeding, but not a lot. This is 1 day later. 1 day later. With a knife, there's no way you can get that. It's still bleeding on the same day. Okay. So sometimes we run into a patient with what we call gummy smiles, where very little teeth are showing, mostly gums, when they smile. So we basically want to do gingival recontour. Okay. So this is what happens when you use a laser on the patient's right side. All the crown has soared, kind of indented, and the patient's left side is not. How do you do this with a knife? Precisely. It's impossible. How do you cut only 1 millimeter of gum away with a knife? You can't control that. It's way too difficult. And all the bleeding that's involved. So with laser, you use a fiber. It's very fine fiber. It's about 0.2 millimeter in diameter, and just go along the gingival and just slowly trim it away. So this is after, this is after, this is before. You see a difference. Okay, depigmentation. In the next day, in the machine, they have to show you a program for depigmentation. Okay. It works better with erbium, and it doesn't work well with dilated. Okay. Because the way it works is by taking off layers and layers of mucosa. Where is the pigment? We don't know. We never know. We just hope when we remove this layer, it's in this layer. But if you see the result is not optimal, you do it again. Some patients, you have to do it 2 or 3 times. But some, you can do it 1 time. This is more common in probably USA because more darker skin, African Americans. But in Asia, I don't think it's too popular to do this. But there are some patients that request this because they have brand new veneers. It looks really white and nice, but now the gum doesn't look so nice. They want to do something. Okay? You can do this with conventional way. Take a diamond burr and start trimming. Doing the same thing, removing the mucosa layer by layer by layer. But you will have much more pain to the patient and much more bleeding. Okay. Herpes. You guys seen enough of these. Normally we don't treat them because there's nothing to treat. In 7 days it's back to normal. But during the process it's really painful for the patient. And it doesn't heal well because it's always around the corner of the mouth. When they eat, speak, yawn, it rips open the scalp. Right? So you irritate it again. So what can you do with the laser? All you do is shine at the surface from a distance, and all you're trying to create is sort of this white cover. What it is actually you heat up the protein, and the protein sheet unfolds and become a harder surface. It's like boiling an egg. Okay. This surface does not rip as easily as like a normal scalp. At the same time, you have bacteria cytoplasm. So this area is sort of decontaminated and a better surface to cover the wound. Patient walks out with less pain. Does it heal any faster? Not really, because normally it heals in 7 days. But at 6th day, we have this healing. There's definitely less scarring compared to natural healing. So here is dentin under microscope with a high-speed burn. You have charring. This is what happens with the Erbium laser. This is why you don't need to etch. Look at the surface. It's so rough, it creates a really good bonding. This is what happens when you shine CO2 to a tube. One pulse. You melt the tube. CO2 is a laser developed in the 60s. You saw that? It's meant for medical surgery. It cuts soft tissue very, very efficiently. So surgeons, they use it for cutting off a big chunk of tissue. But in the mouth, what we do is millimeters. We don't cut off a big chunk. That's why CO2 is not ideal for dentistry. It exists. People still buy it, but it really is not ideal. People only use it to remove plankton, do a lot of surface treatments. They don't use it for surgery. And this is what happens when you place Erbium laser onto a tube. You create a crater. Of course, right in the middle, energy is higher. On the outskirts, energy is lower, so it's not as deep. But this is what you get with one pulse. So, really quick going through all the lasers. You do see one call. Telomere caries syndrome. What really special is the laser head is right here on the handpiece. It's not in here. Why is that important? Because during transmission, if the laser head is in the machine, you have to go through a fiber about 2 meters long, you lose energy. Okay? Some companies tell you, oh, we have 7 watts on maximum output. But is it 7 watts at the laser gun in the machine or 7 watts at terminal? We don't know. They don't tell you. With this, there's less loss of energy. It's pretty easy to operate. It's small, pretty straight. You'll see that in there. The other really good one is a cable Keep 3 laser. Okay. This, the really big special part is it has a feedback system. It automatically detects calculus and caries. Okay, so you can remove them without damaging